to some really important questions.
The chairman of the New Jersey GOP committee tells us why he claims that the state's stay-at-home orders were unconstitutional. Plus, pandemic expert Dr. Dena Grayson is back to answer your questions.
10% of the patients in the homeless shelters actually had symptoms of those who tested positive. So we're really just not testing enough.
And the coronavirus pandemic's effect on mental health, elder care facilities, and finances.
The uptick in overdose-related deaths, suicide-related deaths, even the concern of putting off necessary treatments, that's concerning to folks. And then how to handle the pandemic.
My conversation with Pennsylvania Congressman Scott Perry. That and so much more. Right now on America This Week, United We Stand. Welcome to America This Week, United We Stand. I'm Eric Bolling. 2.5 months ago, COVID-19 pushed the country into a lockdown, but now all 50 states have reopened in some way as each state lifts their restrictions and works towards recovery. Remember, we all stand together in this, and we'll continue to answer your questions and provide updates on coronavirus right here. Liberty University in Lynchburg, Virginia was one of the only college campuses to remain open during the pandemic. Recently, I spoke with the school's president, Jerry Falwell, and his wife, Becky, about how Liberty University kept students safe.
No, we had 0 cases the whole spring semester on campus, and the New York Times actually was on campus in violation of no trespassing signs that we had posted everywhere to protect our students. Only about 1,200 were living here. Normally it's like 8,000 because there's certain students who didn't have high-speed internet in their homes, and we had converted to completely an online format to comply with the governor's orders. And so they couldn't go back home and do their studies. We had others who had elderly relatives at home. We had others who were international students. So about 1,200 came back, and we had 2 surprise inspections from Governor Northam in Richmond, and we got nothing but glowing reports from the Virginia Department of Health: social distancing, takeout food only, double the janitorial staff cleaning.
So Becky, I want to talk a little bit about what President Trump did this week. He demanded that places of worship reopen. He said he was going to go to bat for places of worship. What does that mean to you?
That means a lot. Like Jerry had retweeted, somebody said previously this week, how come we can go to Walmart and we can't go to church on Sundays? And Jerry said, why don't we go to Walmart and have church services? Because they think that's important. And for a lot of people, going to their place of worship is as important as getting groceries because it feeds their inner soul. And so I think what President Trump did by going out and opening the churches, I think that'll help a lot of people's attitude and their heart. And I just can't understand how we've all just kind of sat back and let the government take advantage of this coronavirus, which is terrible, but taking our rights away. And that's just unfathomable to me. I just can't imagine us just sitting down and letting our rights be taken away. And especially the churches, our places of worship.
More than a dozen states across the country face lawsuits over their lockdowns. Now, joining me now is Doug Steinhardt, chairman of the New Jersey GOP committee. Recently, his organization filed a lawsuit against New Jersey Governor Phil Murphy, seeking to end the state's business closures. Thank you for joining us. So you want the governor to reopen the businesses. Tall order suing the state, tall order suing the federal government. What are your odds and what are you going for?
Look, we feel our chances are good. Like any time government gets in the business of creating classes of employers and employees, they turn private property rights into privileges. I think if you're the governor of a state, you basically have 2 jobs: make the trains run on time and protect your citizenry. And Governor Murphy has let down the residents of New Jersey in both fashions. 1.1 million unemployed residents, shuttered businesses from north to south, and still no answers to some really important questions. So,
do you think this is a partisan? It looks to me like I'm watching from from outside of the D.C. Beltway. But I look at the states, and it looks like the red states want to open, the blue states want to stay closed. New Jersey, very blue state. Do you think this is all about politics?
No, Eric, I don't think wanting to make a living for your family, trying to support them and put food on the table is a partisan issue. To the contrary, I've spent a lot of time talking to business owners. I was in Lakewood, New Jersey yesterday, talking to shop owners who've been closed for 10 and a half weeks. I spent the better part of a half hour listening to a single mom cry on the phone to me just 2 days ago after the lawsuit was filed, and she read about it, talking about the fact that she can't pay her rent. She's borrowing money from her neighbors to put food on the table. Those types of things don't discriminate. They don't know partisan politics. All these folks know is that they need to get back to work. They need to get their businesses open, and they need a government that's willing to give them answers. And Governor Murphy has eluded that at every turn since this COVID crisis started.
You know, Doug, I was pointing the finger at Governor Murphy is what I was trying to do there. It strikes me that he may be staying closed because it's the Democrat governor thing to do.
There's no doubt. I have maintained for quite a while now that Governor Murphy's slow walking out reopening the state's economy because he doesn't want to pass the burden off to the public sector labor unions, which is his base. It is patently unfair that the private sector is the only section of the New Jersey economy that's bearing any of the burden of this state shutdown. Not a single public sector layoff, not a single public sector cut or furlough. Governor Murphy, I think, has made it patently clear that he's expecting private sector employers and employees to carry 100% of the weight of this economic shutdown.
Indeed. I noticed that Governor Murphy in New Jersey, but also Governor Cuomo in New York, didn't lay off any of their people and certainly didn't stop their own paychecks from coming in. Let's talk a little bit about some of the scenes we've seen as states start to open up. I'm thinking of in the Ozarks, et cetera, some places in Florida as well, at Daytona Beach, where crowds were so tight on top of each other. Are you suggesting that we open businesses, or you open businesses, but also continue some sort of social distancing even after you open the businesses?
Well, I think one of the reasons why we filed the lawsuit, and one of our concerns, is that everybody should be afforded an opportunity to play by the same rules. And as we sit here today, Governor Murphy hasn't told folks in New Jersey what those rules are. He doesn't play by the rules. We don't know what they are. And when you think you've figured it out, he goes and changes them. For weeks, it was flatten the curve. Then it became, I'll reopen the economy when we get a vaccine. We don't know if or when that will ever happen. Meanwhile, it seems you can't catch COVID at Walmart, but you can catch it at church. 6 people can get in a car and drive around their neighborhood, but they can't sit on a beach. You can't buy a towel or sunscreen at a mom and pop shop on the boardwalk, but you can walk 2 blocks inland and get them at Rite Aid. Every business, every employee, every employer should be able to work by the same rules, Eric.
All right. So finally, final thought. I only have about half a minute or so here, Doug. Have you heard back from the governor's office?
The governor, no. What we've heard from the governor in response to the lawsuit is an attempt to remove it to the appellate division. It's something we support. It will expedite the process. We look to get answers for our fellow plaintiffs and for 9 million New Jerseyans as soon as we can.
All right, we're going to leave it right there. Doug Steinhardt, chairman of the New Jersey GOP. Thank you very much for your time.
Eric, thank you for your time.
Are homeless people disproportionately impacted by COVID-19? Pandemic expert Dr. Dena Grayson answers your questions next on America This Week. United We Stand.
United we stand. We never fall. This perilous fight, it takes one and all. Everyone stands, American strong. Strength by one equals strength by all. American values, American pride. Your neighbor needs you, each person, each time.
We stand, America.
United we stand.
We stand, America.
United we stand.
Joining me now is pandemic expert. She's back, Dr. Dena Grayson. Thank you for joining us again, Dr. Grayson. Let's get right to the questions. Caden asks on Facebook, if COVID-19 is so deadly and contagious, why haven't we seen a huge death toll among the homeless population? What about the homeless population, doctor?
Well, Eric, we are seeing a number of cases in the homeless population when we actually test for those cases. The bottom line here is that we're just not testing enough in this population. So the very few studies that have been done show that there certainly are a number of cases, but only about 10% of the patients in the homeless shelters actually had symptoms of those who tested positive. So we're really just not testing enough is the bottom line.
Yeah, and the next one we'll talk about, I think we may have asked you this before, but let's take a look again. Karen on Instagram wants to know, with summer upon us, right around the corner, she says, but upon us, can mosquitoes transmit COVID-19 from person to person? The reason, I guess why this becomes relevant, because even though we've already said it probably wasn't going to happen, this virus seems to be mutating and evolving as we go. We're hearing more and more cats are susceptible to the COVID-19. Is there any proof of transmission between person to mosquito to person?
Well, first of all, the virus luckily is not mutating very much. But actually what we are doing is we're learning something new really almost every day about this virus. It's a new disease. There's no evidence of any cases from mosquitoes. This is not a mosquito-borne illness. The virus cannot replicate in mosquitoes. So I don't think people need to worry about mosquitoes, but they should worry about that person next to them who's not wearing a mask of catching, unfortunately, the virus from them.
Gotcha. Anna Lee asks on Facebook, if the common cold is another type of coronavirus, just not as severe as COVID-19, and experts can't create a vaccine or cure for the common cold, is it really possible to make a vaccine for COVID-19? Really good question here. I mean, are we kidding ourselves? Are we just going to continue to try and vaccinate against the most recent version of COVID-19, only to find a mutated version is going to kill a lot of people the next time around?
Well, the common cold is caused by a number of different viruses. There are a couple of strains of coronavirus that can cause the common cold, but there are a number of strains of rhinovirus is the most common cause, and that's a virus that mutates very frequently. And remember, the common cold doesn't kill you. So there's not this huge push to develop a vaccine when, there's only about 3 or 4 strains of coronavirus that can cause the common cold. We don't, yet the vast majority of common colds are caused by rhinoviruses. So that's really why there's not a vaccine there. In the case of this coronavirus, there only appears to be one strain.
Doc, I want to ask you a couple of questions with some of the things I'm seeing. First of all, there's a lot being made about reopening. And we're seeing there was a big hubbub about Georgia reopening too soon. They reopened, and there doesn't seem to be a big spike in cases. We know what was going on in Florida. People were freaking out when saw revelers going back to the beach. Again, not a lot of cases post-reopening in Florida. Texas, another massive state that really didn't have a lot of lockdown going on. Not a lot of coronavirus popping up in the aftermath of reopening. Are we sure social distancing is actually the cause for elevated cases of coronavirus?
Well, physical distancing certainly helped decrease the number of cases. And we actually are seeing increases in cases that are reopening. We're seeing what we're calling the second spike during the first wave. So Arkansas is having the second peak, for example. And in Texas, we're seeing an increase in cases in the Dallas area and Houston area. And same thing in Georgia. In certain areas, we are seeing an increase in cases. But also remember, Eric, it's summer. That definitely helps mitigate things a bit. People are outside. That makes it harder for the virus to spread. And where you really see the virus spreading, these super spreading events, are confined indoor areas with lots of people. So the biggest outbreaks have occurred in prisons, nursing homes, and of course, food processing plants, which we're hearing that all around the country.
Yeah, that one's concerning also because we got to keep the food supply chain running. We're seeing a lot of video of fights in say, a Walmart or a Target because someone walks in. In Staten Island, there was a couple that walked in without a mask, everyone kind of ganged up on those people and drove them out. Let's talk about this a little bit. Dr. Fauci's been all over the board on this, on whether, and even Dr. Birx at times, on whether or not is the mask to protect individuals themselves or to protect others?
So masks in general, unless you're a healthcare worker wearing an N95 mask, masks for the general public are really to protect everyone else. If everyone wears a mask, we're all protecting one another. It decreases the amount of your respiratory droplets that you can transmit to someone else. So if we all do it, we're all protecting one another. And that's really the key with the mask. That's why, folks freaked out when some folks walked into Walmart not wearing a mask. They're worried about their own lives.
Well, certainly a ton more questions. Dr. Dena Grayson, pandemic expert, we really appreciate your time. Again, our audience loves hearing from you. Dr. Dena, thank you for your time.
Thanks for having me, Eric.
The pandemic has affected Americans' mental health. What some politicians are trying to do about it. I speak with Congressman Scott Perry coming up next.
United we stand, we never fall. This perilous fight, it takes one and all. Everyone stands, American strong. Strength by one equals strength by all. American values, American pride. Your neighbor needs you, each person, each time.
We stand American
United we stand.
We stand American strong.
City by city, state by state, town by town, stand American great. Everyone stands American strong. When strength by one equals strength by all. American values, American pride. Your neighbor needs you, each person, each time.
We stand American
United we stand.
We stand American
United we stand.
America This Week, America's fastest growing political show, points out how rough and tumble politics shape opinion in every region in our country. We tell American stories, stories that touch our people, determine our politics, focus on the future of America.
I'm Eric Bolling. Join me for a fascinating look at America this week. An ABC News Washington Post survey found nearly 70% of Americans have reported some sort of mental distress since the pandemic. Recently, I spoke with Pennsylvania Congressman Scott Perry about COVID-19 and mental health. You had a town hall relating to COVID-19 and mental health. What did you find? What were people most concerned about?
Well, they're concerned about a lot of things, but the uptick in overdose-related deaths, suicide-related deaths, even the concern of putting off necessary treatments. That's concerning to folks. And then how to handle the pandemic, how to handle being shut in, not only maybe for themselves, but other family members. Many folks know somebody that is all by themselves, alone, either in a home or a facility. And they're concerned about the person that's at home. They're really concerned about the folks in facilities in Pennsylvania. I don't know whether you know this, but probably around 70% of our COVID positive deaths in Pennsylvania are related to elder care, assisted living, nursing home facilities. And the governor has forced those facilities to take on COVID positive patients while not providing them with the appropriate and necessary PPE, expertise, facilities, et cetera. At the same time, disallowing people to have a visitation with their family member. That the family member might literally be in the last days of their life. And so these are all concerns. All these things are concerns of how to mentally cope with and deal with the pandemic and the related, in Pennsylvania in particular, the stay-at-home order, essentially, which is going on now for a very long time.
So how is Governor Wolf doing? I think the numbers you stated regarding the number of deaths, mortality or morbidity within the assisted living and nursing home community is probably fairly widespread. We know New York is seeing similar numbers. But how is Governor Wolf doing in Pennsylvania? I mean, there were a couple of concerns about his slowness to reopen. And we had Rand Paul on recently who said if there are risks, there are actual mortality risks of staying closed. People will, like you point out, avoid doctor appointments, or they may become addicted to certain types of drugs, or go basically off the wagon on alcohol as well. So how is the governor in Pennsylvania doing?
Well, I guess that remains in the eyes of his constituency, his bosses. I will tell you that all day long, our phones are burning up for myself and our whole staff of dealing with people that can't go to work, can't pay their bills. The federal government, as you know, has sent billions of dollars to the states, but the states still administer the program. So in particular, you look at unemployment compensation in Pennsylvania run by the state. It takes a month or two before you see a dime under current circumstances of that money. And so the promises and the policies might be great, but that doesn't pay anybody's bills. And I think that increasingly people are very concerned with this shut-in order, especially when they look at other states where they literally have declining numbers, yet they're opened responsibly or opening more responsibly. They're following the CDC guidelines, and their numbers are declining. Yet in Pennsylvania, like I said, most of our deaths by far are happening in the nursing homes and elder care facilities, which are mandated by the state to take positive COVID patients. Eric, it's crazy to me. The one thing that we knew starting out in this whole thing is that the elderly and those with other health issues were really susceptible to this, and it was really dangerous. And so what did we do? We forced it on them. It's absolutely absurd. And then to add insult to injury, that none of that policy has changed in Pennsylvania. It has changed in other states like New York, where they saw that it was a horrific error. It hasn't changed in Pennsylvania. And to add insult to injury, the state attorney general is talking about prosecuting these facilities for murder. I mean, they're forced to take the patients that are COVID positive into a population really susceptible. And now under the specter of investigations criminal investigations from our attorney general, I just think it's a breathtaking failure of management and leadership, and that's why I've called for a federal investigation of this policy in Pennsylvania.
Well, you'll have to bring us back. We'll bring you back and let us know how it plays out. New York, I mean, look at Governor Cuomo is under quite a bit of fire for his treatment of nursing homes and assisted living facilities as well. It may be another pandemic besides the coronavirus, how we've treated our elderly in these facilities. We're going to say thank you to the Congressman. Really appreciate your time. And by the way, thank you for our freedom. Thank you for your military service, sir.
Thank you, sir. Great privilege to be on with you. Thank you.
As Las Vegas begins to lift lockdown restrictions and reopen, so do their dentist offices. The new safety measures they're putting in place.
United we stand, we never fall. This perilous fight, it takes one and all. Everyone stands, American strong. Strength by one equals strength by all. American values, American pride. Your neighbor needs you, each person, each time.
We stand America.
United we stand.
We stand America.
United we stand. United we stand, we never fall. This perilous fight, it takes one and all. Everyone stands, American strong. Strength by one equals strength by all.
When COVID-19 shut down the country, dentist offices had to stop performing some of their basic services. But now dentists are included in phase 1 of reopening for several states. Gabby Hart with Sinclair station KSNV gives us a new look at the new safety measures they put in place.
Yeah, dentist offices are back open for essential services like teeth cleanings and fillings, and they say it's been pretty busy. But now not only are they focused on dental hygiene, they're also focused on putting the proper safety precautions in place to help protect themselves and their patients from COVID-19. Temperature checks at the door are just one way that dentist offices across the valley are trying to stop the spread of COVID-19.
We go straight from the car to the exam room. So when the patient comes, they call us and then we bring them directly to their room. We make sure all the patients wear a mask when they enter the office.
They also have a COVID questionnaire, and they're limiting the amount of patients allowed in the office to 10 at a time. In addition, staff members have increased the amount of PPE that they're wearing.
This time around, we're putting on an N95 underneath and layering our level 3 mask on top. This now is required. When the shutdown happened, dentist offices remained open, but only for emergency services. Now they're back to offering almost all dental procedures.
A full exam, cleanings, fillings, crowns, implants, extractions, partials, dentures, pretty much everything other than whitening and veneers.
Dr. Quinn with Stephanie Dental Group says they're taking all the appropriate precautions to make sure patients feel safe enough to start coming back. And she advises people not to put their dental needs off, no matter how small you think they might be.
A little cavity could end up in a few months turning into an abscess, an infection. So we want to take care of that before it gets to that point.
Quinn also says anyone having a dental emergency should avoid going to the ER, potentially exposing themselves to the coronavirus, but should go to their local dentist office instead.
1/3 of people that go to the ER go with tooth pain. So we definitely advise them to come here.
And dentists say anyone needing to come in for a routine cleaning or other service should call and make an appointment and just be prepared to follow all of the new safety protocols that are in place. For America This Week, I'm Gabby Hart reporting.
Thank you, Gabby and KSNV, for that story. And thank you all for joining me for another America This Week, United We Stand. The pandemic changed the look of graduations across the country this year. Many families recognized their grads with intimate celebrations at home or celebrated virtually. Some graduating seniors even participated in town drive-by celebrations. Tonight, we leave you with another unique graduation moment, a Blue Angel flyover for the U.S. Naval Academy 2020 class. Congratulations, class of 2020, across the country.
Hooray! Hip, hip. Hooray!